I had a patient walk into my clinic recently who looked absolutely exhausted. She had been coughing for 12 weeks straight. 12 weeks. Her fever was gone months ago. Every COVID test came back negative. Her GP said she was fine, but she was coughing so violently at night that she would vomit. Her husband had moved to a spare bedroom. She looked at me and said, "Dr. Paul, am I going crazy? Why won't this stop?" Here is what terrified me. She is not alone. I am seeing 5 to 6 patients like this every single month. Hello, I'm Dr. Suman Paul, NHS and private respiratory consultant here in Liverpool. If you have been coughing for more than 3 weeks after being better, this video could save you months of suffering. The NHS website says cough clears up in 3 to 4 weeks. But what they don't tell you is what happens when your cough doesn't improve. And more importantly, the 5 underlying causes that get missed over and over again. Now you might be thinking this is just a post-viral cough that needs more time, and you would be partially correct. But here is what's actually happening inside your lungs that nobody's explaining to you. Your cough isn't random. It's not just one of those things. There is a specific reason your body is doing this. By the end of this video, you will know the 5 hidden causes doctors miss, the exact red flags that mean you need specialist care immediately, and why the standard NHS approach often leaves these conditions undiagnosed for months. Let me show you what's really happening inside your airways right now. Think of your cough reflux as a smoke detector in your home. Normally, it takes actual smoke, a real threat, to set it off. But after you have been sick, something changes at a cellular level. That virus you had, whether it was flu, COVID, or just a bad cold, was a war happening inside your airways. Your immune system won the battle. The virus is gone. You are not contagious anymore. But battles leave damage. Your airways are left inflamed, raw, and hypersensitive. Those nerves that control your cough reflex, they are now dialed up to maximum sensitivity. So now that smoke detector goes off from things that would never normally bother you. A gust of cold air, laughing too hard, talking for more than 2 minutes, even just lying down at night in your bed. This is called airway hypersensitivity, and it affects between 11 to 25% of adults after respiratory viral infections. Here is a timeline nobody tells you. Post-viral airway hypersensitivity typically lasts 3 to 8 weeks. In some cases, I have seen it persist for 3 to 6 months. That doesn't mean something is wrong. It just means your body is still doing repairs. But this is crucial. What if it's not just post-viral hypersensitivity? This is where things get interesting. There are 5 specific conditions that either piggyback on that post-viral inflammation or masquerade as it entirely. And these are the ones that get missed in standard NHS GP appointments. Hidden cause number 1 is the nighttime culprit, which is upper airway cough syndrome. Remember the patient I mentioned at the beginning? The one coughing for 12 weeks? This was her problem. Upper airway cough syndrome, what we used to call post-nasal drip, is the most common cause of chronic cough that I see. Yet it's constantly overlooked. Here is why it's so sneaky. The virus inflamed your sinuses and nose, not just your lungs. Those membranes start producing thin, watery mucus that drips down the back of your throat constantly, all day, all night. The telltale signs of this is your cough is significantly worse at night. The moment your head hits the pillow, that mucus pulls at the back of your throat and you are coughing all night long. If this sounds familiar, you likely have post-nasal drip, not a lung problem. But wait, there is an even stealthier cause most people have never heard of. Hidden cause number 2 is the silent killer, laryngopharyngeal reflux. When I say reflux, you probably think heartburn, but there is another type called laryngopharyngeal reflux or LPR. We call it silent reflux because you might have zero heartburn. Here is what's happening. Microscopic droplets of stomach acid are traveling all the way up your esophagus and splashing onto your voice box and throat. Also, it doesn't have to be acid, it could be non-acid as well. These tissues have zero defense against stomach acid. The classic signs of this condition are dry persistent cough, constant throat clearing, hoarse voice, especially in the morning, feeling like there is a lump stuck in your throat. Here is the connection nobody makes. That violent coughing from your respiratory infection can weaken the sphincter that keeps stomach contents down. So the virus can actually trigger or unmask silent reflux. I had a patient last month. 6 months of coughing, saw 3 different doctors, tried 4 different cough medicines, nothing worked. I diagnosed silent reflux and started appropriate treatment. Within 2 weeks, her cough was 80% better. Now here is the one that surprises most people. Hidden cause number 3, the asthma you don't know you have. You hear asthma and you think, no, that's not me, I don't wheeze. But there is a specific type called cough variant asthma where the only symptom is chronic dry cough. Many people have mild underlying airway sensitivity their whole lives without even knowing it. Then a major respiratory infection comes along and acts like a trigger, unmasking the condition. The telltale signs of this condition is significantly worse at night or early morning. It is triggered by exercise, especially the cold air. Triggered by strong smell, smoke or perfume. It is dry, non-productive cough. What's happening is your airways are twitchy. They are constricting and spasming, and your body's only response is to cough. But what if it's not viral at all? Hidden cause number 4 is bacterial infection, the one antibiotics actually help. The NHS guidance correctly says that most coughs don't need antibiotics, and that's true, most don't. But there is a subset of patients who develop a secondary bacterial infection after their initial viral illness. Bacterial bronchitis, sinusitis, even early pneumonia. The signs that suggest bacterial infection are cough producing thick green or yellow mucus, symptoms that improve then suddenly worsen, persistent fever or fever that returns, feeling progressively worse rather than better. In my private respiratory clinic, I can do a thorough chest examination and if needed, arrange a chest x-ray within 24 to 48 hours. If there is evidence of bacterial infection, targeted antibiotic treatment can resolve the cough within days. And here is the one that almost never gets considered. Hidden cause number 5, medication side effects. Certain medication, particularly ACE inhibitor, used for blood pressure like ramipril, lisinopril, cause a persistent dry cough in up to 20% of patients who take them. This cough can start weeks or even months after beginning the medication. And here is the frustrating part. It can persist for weeks after stopping the medication. If you started a new blood pressure medication in months before your cough began, this could be your answer. But it requires a careful medication review, something that's difficult to do thoroughly in a 10-minute GP appointment. So why do these 5 causes keep getting missed? NHS GPs are doing an incredible job under immense pressure. But the reality is that diagnosing chronic cough requires time and tools that aren't always available in the standard NHS GP appointments. Here is what's needed for proper diagnosis. Comprehensive assessment, 30 minutes minimum. Detailed symptom history, medication review, examination of your chest and breathing pattern. Specialized testing, for example spirometry, which can diagnose cough variant asthma in 30 seconds. Chest x-ray or even CT scan to rule out infection or structural lung problem. Sometimes you might need a laryngoscopy, which is done by the ENT doctors, to visualize the vocal cord inflammation from silent reflux. You need access to specialist treatment if you are diagnosed to have a cough. One of the examples is Gepapixant or Lifnua, a breakthrough medication specifically designed for refractory chronic cough that's not routinely and easily available through the NHS due to prescribing restrictions. And this is where specialist care makes all the difference. The tragedy is that most people suffer for months because they don't know this condition exists, don't have access to the right test, or can't get specialist treatment through standard NHS pathways. You don't have to wait months for answers. In my private practice in Liverpool, I see patients within days. I have put a link in the description box to book a consultation with me directly. Don't suffer in silence for months when answers and effective treatment are available right now. If you found this helpful, please like this video so others can find accurate medical guidance. Subscribe for more evidence-based respiratory health information. I am Dr. Suman Paul and I look forward to helping you breathe easier and sleep better soon. See you in the next video.